everyone. A very good morning to all of you. Hello, very good morning to all of you. So, happy Republic Day, first of all. So, I welcome you all for today's session. I am Dr. Priyanka Sachdev here. Do you know why I am here today? I will come on this later. Let me ask you a question before that. Yes, happy Republic Day to all of you and a very good morning to all of you. Yes. So, I want to ask you a question before I tell you why I am here today. Let me tell you something. Since last 12 years, I am teaching second prof subjects, that is pathology, pharmacology and microbiology to students on various channels and various platforms. During this journey, I came across through multiple challenges which are faced by the students. So before coming on the point, first let me enumerate the challenges. You tell me these are correct or not. Let me tell you the challenges which are faced by the students. The most important challenge the students face during their preparation, during their journey in the second prof is inability to sit and focus for the long hours. Most of the platforms are offering the recorded lectures and students lack the dedication to sit and focus for long hours and study or watch the recordings. So they lose the concentration easily, they get distracted easily and struggle to find a drive to study. Okay, the second is lack of motivation, isn't it? So students keep on dragging the syllabus, the second prof syllabus for the entire year, yet they remain unprepared. Just a second. Give me a second. Yes. So yet they remain unprepared, still on even on dragging the syllabus for the entire year. The next is ineffective time management. Students are unable to manage the time. They make schedule. They try to struggle to stick on the schedule. They revise the schedule multiple times, hoping they will catch up again. So this making and breaking cycle of the schedule goes on, goes on, goes on through the entire year, and they waste a lots of time, isn't it? The next challenge the student face is difficulty in retention due to the vast voluminous subjects. All three subjects are very vast: pathology, pharmacology and microbiology, and that's why students feel difficulty in that. The next challenge student faces inability to revise effectively. So although even anyhow they complete the syllabus and they are not able to revise, so without revision it is of no use. They don't retain it properly and they can't recreate the answers in their exam. So the next most important challenge they face is the dilemma whether they should prepare for NEET PG or they should prepare for university exam during the second prof. So most of the students after passing first prof, as soon as they enter the second prof, they realize how is the competitive thing is there, and they have to start their NEET PG or PG competitive exam preparation in the second prof itself. They realize this. So they want to prepare for NEET PG in second prof itself. But for doing so, they have to compromise. Sometimes they compromise for the university exam. So most of the students want to excel in both. In the second prof itself, for the three subjects, they want distinction in the university exam, as well as they want to prepare these three subjects for their competitive exam, isn't it? And the most important challenge the student face in second prof is lack of integration. Most of the students study the three foundation subjects, patho, pharma and micro, in isolation without integrating with each other. So basically, let me explain you. In pathology, they read the pathogenesis of a disease. For a particular disease, they read the pathogenesis and etiology, gross microscopy of that particular disease. In microbiology, they read the associated microorganisms, and in pharmacology they read the drugs to treat the diseases. But the students study the three subjects in isolation. They don't integrate. Since they don't integrate, they don't see the overlap, and it will create the volume. You know, there are lots of things which are overlap in the three subjects that can save the time if you study them integrated way. So it creates fragmented retention, which is poor retention, and difficulty in solving the clinical scenario based question, which are most commonly asked nowadays in the competitive exam, isn't it? Yes or no? You find this correct or not? So looking at all these challenges, I felt the need to simplify the learning process. And after a month of planning, preparation, countless revision, I am proud to announce my course, Prof Buster Live. So we are launching Prof Buster Live. The first batch is Progenitor Batch, Fab 2025. The batch is starting from 10th of February. This 10th of February 2025, this batch is starting. So in this batch, now let me tell you everything. In this batch, I will cover the three subjects of the second prof, that is pathology, pharmacology, microbiology, according to latest CBME curriculum. The microbiology is also covered according to latest CBME curriculum. That is, I will teach microbiology system wise, not the organism wise. Okay, so this course is specifically designed for keeping the needs of second prof MBBS students in mind. Okay, it is tailored. It is an online live series which is tailored specifically for second Prof MBBS students, and the course duration is 3.5 months. The starting date is 10th of February. It is starting from 10th of February, and it will end. The last date is 28th May. So approx 3.5 months. The entire syllabus of the 3 subjects will be covered live, and recordings will be available for 1 year, but all the topics will be taught you live, all, each and every. And it's a comprehensive course. It's not a rapid revision. Each and every topic in all 3 subjects will be dealt in detail conceptually. Okay, so this course is designed keeping 2 things in mind. There are 2 goals for this course. Number 1, to prepare the students, to give them solid foundation for their NEET PG preparation, as well as simultaneously they can get distinction in the university exam in these 3 subjects. I mean, it is not only for university exam preparation. Here we will prepare you for both. For university exam, we will prepare you how to answer right answers, I mean long question, short question in your exam, and I will help you in solving the tricky MCQs, image based MCQs, clinical scenario based MCQs of these 3 subjects. So both the goals will be fulfilled. It is India's first ever integrated learning experience for second Prof subjects. So here I will teach you Patho, Micro and Pharma in an integrated way. In a very integrated way, I will tell you the detailed schedule. I will come on that. Wait a while. So in an integrated way, I will explain you all the 3 subjects. What do you mean by integrated learning in these 3 subjects? How I will integrate the syllabus of 3 subjects? Let me explain you. So in human body, these are the major systems. I'm talking about systemic pathology, systemic microbiology and systemic pharmacology, not general. General, I will deal these 3 subjects separately. But in systemic patho, systemic micro and systemic pharmacology, we have to deal with all these systems in human body. So we will take the system one by one. Suppose we are taking the first system, any system. Suppose I'm taking CVS, the first system I'm taking CVS. So first of all, in that particular system, I will teach you the pathology of that particular system. I will deal with all the diseases, the pathogenesis, etiology, gross microscopy, all the diseases I will teach you in that particular system. Then we will come on microbiology. So I will teach you the associated microorganism in that particular system. Suppose in CVS, here I will teach you the MI, ischemic heart disease, endocarditis, and rheumatic heart disease, congenital heart disease, all the diseases I will teach you in detail in pathology. In microbiology, I will tell you the microorganisms which are associated with infective endocarditis. How many bacteria, viruses, fungus, parasites are causing bloodstream infections. We will enumerate it here and we will see the details of each of them. Then we will come on pharmacology, in which I will teach you the drugs of all those diseases. So here I will teach you cardiovascular drugs. So by this approach, system by system, it will fit in your mind, it will save time, it will give you a better retention, better correlation, believe my words. Okay, so in this way, we are going to take these systems one by one and complete these system in all 3 subjects one by one. That will be the flow. That will be the flow of this batch. I hope you got it. Okay, so yes. So what are the advantages of this integrated learning? Why I'm not teaching you complete patho, then coming on complete micro, then coming on complete pharma. No, in this integrated approach, you will have 360-degree holistic understanding, better retention, fast revision. You can do fast revision. I will give you master charts of all the complete subject. I will compact in a very concise manner in the form of the master chart. You can do very fast revision in an integrated way. It will be time saving. As I told you, there is always the overlap. And you will be able to solve clinical question answers, clinical scenario based question answers, which are most commonly asked nowadays, as you are saying. Yes, absolutely right. Now, the most important question many students are asking me, ma'am, why you are shifting from recorded version to live version? Initially, we were offering the recordings of the subjects. We were having a course, Pathology Prof Buster, and it was a super hit course. Students like it very much. But it was a pre-recorded course. There was no live series in that. But why we are shifting from recording version to live? Let me explain. In live version, the recordings are also available. Till 1 year, the recordings will be available. But first, we will teach you live. We insist you to come on the live, to stick on the schedule. And if any case, if you in certain emergency or sometime you are missing the live, the recordings are available. So it is one step ahead of the recorded version. In recorded, you get only recorded. In live, you are getting live plus recorded. First of all, you understand that. Now, suppose I'm offering you only recorded version of all 3 subjects. If I'm giving you the recordings, straightforward, just you take the recordings. So how many of you have a habit of consistent sitting for hours by yourself? You sit for 2-3 hours daily and watch the recording monotonously, unilaterally from one side. How many of you can do so? I assume very few students who are highly motivated and highly dedicated, I must say. Most of the students get distracted very easily. They don't have the disciplined sitting. So here in live session, I will ask you to come daily live for 2 hours. 2 hours daily, 6 days a week, except Sunday, Monday to Saturday, every day. You just give me your 2 hours out of 24 hours daily for 3.5 months. For 3.5 months, you do so. And I will give you distinction in second prof, as well as I will prepare your these 3 subjects for your NEET PG. You don't have to look these 3 subjects till your internship. It will fit in your mind in that way. Okay, that is my guarantee, I can say. Okay, you can mark my words. So first of all, I will make a habit of sitting of consistent progress. So disciplined learning. We are providing disciplined learning via live sessions. Number 2, why recorded versions are not better and live are better? The second reason is lack of engagement. In recordings, there is lack of engagement. There is unilateral learning. You can't interact with the educator and the peer group. Okay, so here we have a good engagement. You can discuss among yourself. You can ask your doubts with me, and there will be active involvement of you also, the students also. So that's why we shift to the live learning, interactive learning. Second, the third thing, while watching the recording, you have many doubts. You keep inside you only in your mind. You don't ask it instantly. There is no way. You write down in the comment in a community, but they are answered later on. But what if your doubts are solved instantly during the class? So in live learning, you can ask the doubt instantly at that point only. Wherever you have a doubt, it will be instantly addressed if you are learning in live. So real time doubt solving will be there, and there will be consistent and disciplined in preparation. You make your schedule, you make your timetable that in the 3 months I will study this, in this day I will study patho, in the particular day I will study pharmacology. You make a schedule very enthusiastically. You stick on your wall. But for how many days you follow it? You follow it for few days, and after that the schedule goes somewhere. You don't follow it. You revise it so that you can catch it again. But again, you are making the schedule, breaking the schedule. So you don't have a structured routine. So here we are dedicated to complete the syllabus in 3.5 months. Whatever session is scheduled on a particular day, it will be there on that particular day. Okay, so schedule structure will be there, and you will get many peer like-minded students like you only, who all are preparing for the second prof university exams, and you can make a group and you can discuss among yourself. We will provide you a community. Okay, and after that, the most important question coming in your mind: what if you have missed the live session? No worries, recordings are always available with you. You can anytime come with the recording for revision purpose also. If you are missing the live session, recordings are available for 1 year. Till your exam, the recordings will be there. You can revisit the topic as and when needed. You can anytime catch up. So recordings are always there, but still I insist, unless until if it is not an emergency, please attend it live. It will be a unique experience, believe me. But if you can't do it live, recordings are available. It's your choice. So what all things we are offering in this course, that is Prof Buster Live. What all things we are offering? We are offering live sessions. We are offering the recordings of the live session for 1 year. We are offering workbook. All 3 subjects workbook will be provided to you. Notes will be uploaded daily. Whatever I will teach you, the soft copy, the PDF will be uploaded in the app on daily basis before the class itself. Annotated notes will also be uploaded daily after the class. So notes will be uploaded before the class. Annotated notes will be uploaded after the class. Workbook will be provided pre-hand before the session start, before the batch start. Okay, and there will be daily quiz immediately after the class. So whatever topic I am teaching you in the class, the quiz, 25 question quiz will be there of that particular. In the 2 hours, whatever I will teach you, you have to attempt the questions which are already asked in NEET PG, FMG, INICT from that particular topic in the quiz. After that, there is T&D once a month. Okay, I will give you the details. I will provide you master charts. The master charts will be provided in the form of hard copy as well as soft copy. The hard copy will be couriered to your doorstep. You have to provide the address and it will be couriered to you once you enroll. And it will be provided to you free of cost. Of all 3 subjects, I will provide you the master charts. We will take live sessions of practical and viva voce also of all 3 subjects. After completing the theory, there will be live sessions only of the practical, and again the recordings will be available. And we will provide you 3 type of question bank. Okay, I will come. What are the 3 type of question bank? Let me elaborate these points one by one very quickly. The first one, okay, the first one is live sessions. Live sessions, as I told you, the batch duration is 3.5 months. I am completing the entire syllabus Patho Pharma Micro in 3.5 months. Okay, there will be live class daily 2 to 2.5 hours. So we will start 5 p.m. onwards. 5 p.m. till 7 or 7:30 p.m. daily, except Sunday, 6 days a week. From Monday to Saturday. These are the live classes. So in pathology, total 27 sessions are scheduled. I will give you the detailed schedule also. 27 sessions in pharmacology and 27 in microbiology. So total 81 live sessions are there. So 81 live sessions, 27 of each subject into 2.5 hour, 2 to 2.5 hour. So there will be 60 hour live learning, live hours of each subject. So total 180 hour live learning will be there in 3.5 months. If you give me 2 hours daily, in 3.5 months, it will be 180 hour live learning in which entire syllabus we are covering. And after every live session, there is a quiz, as I told you. So there are 27 quiz in each subject immediately after the class. So total 81 quiz are also there. So this is the basic structure of the class. I hope you are getting it. Yes, I will address your queries. Wait a while. Let me explain the plan. Okay. As I told you, after every live session, there is quiz. Every live session. So total 81 live sessions and 81 quiz are there. Out of the 81, 27 live sessions are of Patho, 27 are of Micro, and 27 are of Pharma. So total 81 live sessions. Each session lasts for 2 to 2.5 hours, maximum 2.5 hours, because it is daily. Okay, 5 p.m. onwards. Okay, quiz so that you can solidify the concept immediately. Whatever I am teaching you today, suppose I am teaching you a particular topic, MI. Immediately after the class, you attempt the questions in the quiz and you see where you stand, how much you have the understanding, and you will feel confident that you are prepared for your NEET PG also. All the MCQs, the clinical scenario based MCQ, image based MCQ, tricky MCQ, you can solve on that topic. So immediately that will solidify your concept. We will provide you workbook. The workbook will be provided in the form of PDF. Okay, you can download from the app and take a printout if you wish. Even if you are enrolling, I will insist you to take the printout before coming in the class. Because Achha, you tell me what are the best notes? Which book provides the best notes for the students of second prof? The 3 subjects. So the answer is your own notes. Once you write in a copy by yourself, you are not writing in a copy, you're writing in your mind. So the best notes is your note. But most of the students say, ma'am, whenever you are teaching, we are not synchronizing with your pace. So whatever you are teaching us, we are lagging behind. If you are writing, we are not understanding the concept. If you are understanding the concept, we are lagging in writing. So we can't synchronize the understanding plus writing together to make the notes while watching the live class. So the best solution is the workbook. So in workbook, 60% of the content is already filled. 40% you have to fill during the class. So here structured fill in the blanks are given. Okay, structured. I have meticulously designed this workbook of all 3 subjects where structured fill in the blanks and boxes are given. Most of the information, 60% is given to you. But whatever is the most important hardcore content, I want you to imprint in your mind, that is blank in the form of boxes you can see and fill in the blanks. Okay, so I will ask you to fill during the class so you can maintain the pace, synchronized with the teaching, and there will be active learning. You will not sleep during the class. If you sleep during the live class, you will miss to write in the workbook. So that is the concept of the workbook, but it is not a hard copy we are providing. We are providing the PDF of all 3 subjects, all 3 workbook, downloadable from the app, and take a printout also. Okay. Notes will be in the form of the soft copy. It will be uploaded in the app daily after the class. My notes are very simple. No paragraph in any of my notes of all 3 subjects. My notes contains only flowcharts, reproducible diagram. They are highly retainable and comprehensive. And most importantly, they are sufficient for competitive exam as well as university exam. For university exam, you can do long question, short question, answer writing from the notes. And for competitive exam, you try any source, any question bank in the world available. You will be able to crack all the questions. That is my challenge. You can try by yourself. Okay, so that is regarding the notes. Annotated notes also we will upload daily. If I'm teaching something extra, I'm writing during the class, it is not available in the notes. Annotated notes will be uploaded daily after the session. So there will be 81 files of annotated notes, 81 files of notes. After each session, it will be uploaded. T&D will be once a month. So total 3 T&Ds are planned. The dates I will show you in the schedule. In T&D, 100 question test will be there, in which ranking will be there. Okay. And first 3 students will get the prizes accordingly. Okay. And after that, I will do the live discussion of those 100 questions. That is the most important thing. So live discussion will be there of those 100 tricky exam level based question. Okay, that will simulate the real exam of NEET PG, FMG, INACT, the competitive exam I mean. So T&D will be once a month. Okay, after that master charts, as I told you, the hard copy will be provided by courier free of cost at your doorstep. Okay, of all 3 subjects. Pathology, I have compared the important diseases and cancers together. Microbiology, I have compared all microorganisms together in a column. Okay, and in pharmacology, I have compared all drugs together. So complete patho, pharma, micro can be revised like this up from the master charts once you have concepts behind that. Okay, so master charts will be provided to you. the hard copy as well as soft copy. Then practicals and viva voce. We will take live sessions of all three subject, practical and viva voce. Once we will finish the theory, live classes only, in which I will cover the exercises, potters, specimen, table viva, grand viva. I will cover everything. Now there are three type of question bank, as I told you. The first question bank is university exam question bank. So in all three subjects, university exam question bank is available, in which all the LAQ, SAQ, VSAQ of all the universities from the India are covered. You can see, if I'm teaching you a particular, suppose I taught you CVS today in Patho, you open the question bank of CVS Patho, you see what all questions are already asked in the previous years and whether these are taught in the class or not. If any topic is missing, it is there in the PYQ and it is not covered during the class, the next day you can tell me, ki ma'am, that topic was there, it was asked in the last year, but it is not covered yesterday. We can cover that like that. So you can cross check all the topics given there will be covered during the live classes. The second question bank is MCQ question bank, in which we will give you exam level questions, the new questions for NEET PG, FMG and INICT preparation. It will be subject wise, it will be chapter wise. Of all three subjects, chapter wise MCQs are given, and it is the most authentic question bank, I can say. Okay, the third question bank is PYQ question bank, in which the three exams, the competitive exams, NEET PG, FMG and INICT, the last 3 year questions are available with their solutions. So you can attempt it anytime and you will feel confident that while preparing for university exam, at the end of that, you are prepared for these 3 exams also, for those subjects out of 19 at least. Okay, now what is the ideal path? With all these offerings, what is the ideal path I'm expecting? First of all, you read the brochure completely. The brochure will be after this session. The brochure will be given in the comments of this YouTube session only. You can read all this information. Whatever I'm telling you, it is available in the form of brochure also. So soft copy of the brochure will be uploaded. Please read it. The same information will be given. Okay. After that, you want to enroll or you take a free demo, it's your choice. After that, get the master charts. We will courier the master charts, the master charts to you at your doorstep. You receive that. You take the printout of the workbook, which is available on the app. After that, attend the live session daily. Give 2 hours live, your live hours daily to me, 5 to 7, 6 days a week. If you miss the live session, watch the recording. After that, attempt quiz daily, immediately after the class. After that, revise the notes, annotated notes if you wish. Okay. And give T&D. Give T&D once a month. Attend the practical sessions, and 2 things I can guarantee. If you are following this path, sticking with me with this path for 3.5 months, 2 hours daily, if you're sticking, I can assure 2 things. I can take the guarantee of 2 things. Number 1, you will definitely get distinction in your university exam, and you will have a strong foundation or complete preparation of the second prof subjects for your competitive exam, NEET PG. Okay, now coming on the detailed schedule, day-wise schedule. So here is the color coding of the 3 subjects you can see. Patho is indicated by red color, micro green and pharma blue, and T&Ds are shown by blue color. So we will take system by system. As I told you, integrated learning now. So first I will start general of all 3 subjects. You can see, so it is starting from 10th of February and general is ending on 25th of February. So for the first 15 days, we will finish the general of 3 subjects. So you can see general patho, we are taking this topic, then general micro, then general pharma, again general patho, then again general micro, and in the pharma we will take ANS also. So general and ANS in pharmacology will be covered in the first 15 days. We are starting from 10th of February. So general will be covered on 25th of February. Adequate breaks are provided to you. Apart from Sunday, few breaks are provided in between. Okay, so that you are not burnt out. After that, we will come on oncology. I will teach you oncology in all 3 subjects in the 4 days. I will teach you neoplasia and pathology, oncogenic organism in microbiology, and anti-cancer drug in pharmacology. So you will have a clear concept of the oncology. Then we will come on immunology. For the next 7 days, we will finish immunology, all 3 subjects. So we will take immunology from the patho as well as micro. In pharma, we don't have immunology. Okay. Then we will come on hematology. In hematology, we will see RBC disorder, platelet disorder, and WBC disorder in patho. And we will see drugs acting on blood and blood formation, anticoagulatory drugs. Okay. All the drugs in pharmacology here. So we will integrate. Then we will come on CVS. I will teach you CVS of all 3 subjects in 10 days. So it will start from 22 March till 31st March. So these 10 days will be CVS, complete CVS of all 3 subjects. So first I will teach you microbiology, bloodstream and CVS infections in 3 parts. Then I will teach you pathology, vascular disorders, heart disorders. And then I will teach you pharmacology, cardiovascular drugs. So complete CVS will fit in your mind like anything. Then we will come on respiratory system. In respiratory system also we will follow the same sequence. First I will teach you respiratory disorders in patho. Then I will teach you respiratory infections in micro. And then I will teach you respiratory system drugs and pharma. So, it will be super easy. You will feel like these subjects are cakewalk for you if you follow this approach. So, first you are understanding the pathogenesis of asthma. And then at each step, I will tell you the various drugs which are blocking the flowchart. It will fit in your mind like anything. Okay, here I will tell you the organisms, all organisms, bacteria, virus, fungus, parasite, which are causing infections here in respiratory system. Got it? Then we will come for GIT. You can see we are covering the GIT in 7 days. It starts from 11th of April till 17th of April. So first we will see GIT disorders in patho. Then we will see GIT infections in micro. And then we will see GIT drugs, in which I will teach you anti-emetic drugs, drugs for peptic ulcer, diarrhea, constipation, all the drugs we will take here. In one day, I will teach you the 2 hours, all the drugs. Okay, then we will come on hepatobiliary and pancreatic system. So we have hepatobiliary and pancreatic disorders in patho. We have hepatobiliary system infections in micro, but in pharmacology, we don't have hepatobiliary drugs. Most of the infections are treated surgically here. So here in pharmacology, I have taken antimicrobial drugs, 2 episodes of antimicrobial to club here. Okay, then we will come on skin and soft tissue, and musculoskeletal. First, here in patho, we will see all the bone tumors, skin tumors, and soft tissue tumors here. Then in micro, we will see all the infections, bacteria, virus, fungus, parasite here of the skin and soft tissue. Then I will take PNS from here. I will take the PNS, drugs acting on PNS in pharmacology. Coming on central nervous system, again, here I will teach you pathology, CNS disorders, then microbiology, CNS infection, and then pharmacology, the drugs acting on CNS. We will take all the drugs, antidepressants, antipsychotic, drugs for the Alzheimer disease, anti-Parkinsonism drug. All the drugs will be dealt here one by one. Whatever given in the standard textbook, all the chapters will be dealt. Detailed syllabus also I will give you. What I will teach you in episode 1, episode 2, episode 3, that split I will give you. I will also give you that. So you can cross-check from any of the standard syllabus or CBME curriculum. Each and every topic will be dealt here. And that too live, that too integrated. Okay. The next is urogenital. The same strategy is followed. You can see patho, followed by micro, followed by pharma. That is for urinal system. That is for genital system. So urinary system, and that is the same sequence we will follow for the genital system. Endocrine, you can see the same sequence. First, we will see disorders in the patho. Then we will see the infections in the micro. And in pharma. In micro, we don't have endocrine system. So we have in patho and pharma, not in micro. Okay, and finally, I will mop up everything. Whatever left from the three subjects, I will mop up in the 3 days. Last 3 days are miscellaneous mop up. If I left any topic untouched and you feel it's important, kindly let me know. I assure you, I will cover that topic in the mop up. The mop up is the miscellaneous. 3 days we kept extra here. If anything is left, we will cover here. Okay, so that is about all the complete schedule. You can see the dates. These are the dates of February. Okay, the batch is starting from 10th Feb, as I told you. In Feb, we don't have any break apart from Sunday. In March, we have one T&D on one of the Sunday. And some breaks are there. You can appreciate in March. This is April, this is May. On 28th May, we are packing the batch. So on 28th May, so please give me your 3.5 month, 10th Feb till 28th May. Approx 3.5 months. You give your time, you give 2 hours daily, 2 to 2.5 hours daily, 5 to 7 p.m. You just give this slot of your life to me. I will give you 2 things. I will assure 2 things after that. You will definitely get distinction in your second prof. You don't have any choice. You will get. And second, you will excel in NEET PG and ICT preparation for these 3 subjects out of the 19. You don't have to touch these subjects up to your internship. It will fit in your mind. And you can correlate these 3 subjects better in the medicine, surgery, and final year subjects. These are the foundation subjects. Patho, Micro Pharma, these are the foundation. If that is clear, your medicine, surgery, and other subjects, you can correlate it better. Pediatrics, you can correlate it better. So here, these 3 subjects foundation will be done very in an integrated way. So that is about that. Still, if you are confused, you are unable to decide, since it is the first time in India, someone is teaching integrated second prof subjects, the 3 subjects in an integrated way, system wise. If you are confused, you can take a free demo. Free demo is for 1 week. Till 7 days, you daily can come live. So 6 days. In 1 week, I will go live for 6 days, 6 into 2.5 hours. So nearly 15 hours of live teaching I'm giving free of cost. You can come anytime. You can come, you can join the live class, you can see the recording, you can appreciate all the offerings we are giving, notes, annotated notes, you can see the question bank, you can see the level of questions in that, and you appreciate everything. Once you become satisfied, then only enroll. I insist you to take the demo. I insist you don't enroll. Please don't enroll. Don't enroll. First you try by yourself. Don't trust my word. So try by yourself. Okay, so please, you can scan the code for doing the registration for the demo, and the link of the demo is there in the pinned message of this comments. In the comment section, there is a pinned message. There is a link. You can click on the link, or you can scan. You can register for demo. Demo is free, but registration is mandatory. Without registration, there will be no entry in the demo. So registration is mandatory. You have to register. Okay, if you want to attend, if you are interested. So please do attend. At least give few minutes. Come for 5-10 minutes. You will have an experience of integrated learning. I'm explaining here everything, but experiencing it is very different. You will experience how I'm integrating the 3 subjects with each other. So you will understand that. Anytime you can come. Okay, the batch is starting from 10th of Feb, the Progenitor Batch. So here is the pricing of the combo plan. In combo plan, we are offering all 3 subjects at a very subsidiary price. Patho, Pharma, Micro, all these things, the live sessions, the recordings, the question bank, the T&D, notes, annotated notes, the free master chart delivery, everything along with the welcome kit, it will be provided at this cost. Okay, since it is the first batch, we are giving the discount. That is the combo plan. But many students say, ma'am, no, I want only 1 subject. My 2 subjects are already strong. I don't need any assistance for that. But one of the subjects, maybe micro, maybe patho, maybe pharma, I need assistance or guidance in that subject only. No worries, you can go for single subject plan. So these are the pricing of the single subject plan. So everything, the same combo is provided. Here you will get the question bank, master chart, everything, but of that particular subject. In combo, you are getting all the 14 offerings. I'm giving 14 offerings. All of them for all 3 subjects. Here all 14 offerings are there, but only for single subject. That is the only difference. So you can go for 1 subject also. Okay, still if you have any queries, please text your queries on WhatsApp of this number. You can note down the number. It's 9321001103. Please note down the number. If you have any queries, you just text it here. We can assist you. The team can assist you. And please set the reminders. It's 10th of February, 5 p.m. Okay, just give few minutes. You attend the free demo only. I'm not saying to enroll. Don't enroll. Even if you are thinking to enroll, wait. Attend the demo first. You experience it. First, I want to satisfy and show you what is real integrated learning here for the second prof subjects. You have not realized what we have created for you, what we have designed for you. So once you will see it now, then only you just take a decision by yourself. Thank you so much. Now, if you have any doubts, kindly let me know. I will address your doubt. So first, how to access all this? You just fill the Google form. You just do the registration for the free demo. The team will guide you. You will get the email and you will get all the details how to access the course. Okay, soon we will provide you the link of the app on which all these offerings will be there, and that too free for 1 week. Okay, so just scan it, or the link for registration is provided in the pinned message also. So please, I insist you to scan it or take the link from the pinned message and give your details if you are interested, and attend the free demo at least for few minutes or few hours out of 7 days. You just experience all the features. I told you 14 features. You experience everything. You see the question bank by yourself. You see the 3 type of question bank. You assess the authenticity of question bank. You see the level of question bank we have created. You experience the live learning. You see the integration, how I'm doing of the 3 subjects. You see the flow of the classes. How we have created the schedule. I took months and multiple revision to create this dedicated, meticulous schedule in which I am integrating the complete syllabus of the 3 subject system wise. Okay, it is a tedious exercise and we successfully done it for you. So I want you to experience everything. Experience the master charts. Please see the master charts, the most awaited, the most in demand master charts. See that by your eyes. After that only, if you are satisfied, you can go for the enrollment. Okay, got it. Yes, definitely it will be helpful for USMLE preparation also. And you can take the free demo. Now, I'm saying again and again, take a free demo, at least for 1 day, for few hours. You will realize everything. Okay. Any other query you are having? If you have any query, you can ask here, or you can leave a comment after this session, or you can WhatsApp your query here. Whatever, I personally address your queries here. Okay, thank you so much. Thank you for giving your precious time, and hope to see you all in the free demo live classes. That is 10th of February. 10th, please mark your calendars, set your reminders. It's free. Please come for a few minutes. 5 p.m. That's it. Thank you so much. Bye-bye. Happy Republic Day once again. Thank you so much. Bye. I'm ending the session.